Good morning, everyone. Hello. Thank you again for joining us today. And as a reminder for those that just hopped on, please keep yourself muted during the meeting if you are not speaking, but continue to utilize the chat function if you have any questions. So I just wanted to say hello and welcome to the 2020 Minnesota Breastfeeding Coalition's annual meeting. My name is Katie Galloway and I am the current board chair for MBC. Typically, we would conduct our annual meeting during the fall conference. However, as I'm sure with many of you, MVC has had to shift and pivot how we operate. And so this annual meeting is just one of those items that is coming to you a little bit different this year. And typically, because of our nonprofit status, we are required to have this business meeting, and it would oftentimes be something where if there was any items or motions that would need a vote by our membership, this would be the time that we would do that. But I did want to just mention that we do not have any motions or items that need a vote by our membership this year. So with that being said, it is our honor to share this time and space with you, and the work that you do is so important and valued. And I just really want to say thank you so much for taking the time to be here with us this morning. And with that, I would like to welcome Tina Lukes-Ratz, our chair-elect for MBC, for the land recognition.
Good morning, everyone. Thank you for being here. Thank you, Katie. So the Minnesota Breastfeeding Coalition acknowledges that the land that surrounds us is a part of who we are. We are holding this virtual workshop on the traditional, ancestral, and present-day home of Indigenous communities. The beautiful land we all love is the stolen land of the Dakota and Ojibwe. Today, there are 7 Ojibwe reservations and 4 Dakota tribal communities in Minnesota. For the majority of thousands of years, Native families have lived on this land. Babies thrived on their mother's milk. Colonization, violence, and forced family separation destroyed the legacy of breastfeeding within these communities. MBC is honored and privileged to work alongside the Indigenous Breastfeeding Coalition of Minnesota, as well as many Indigenous and non-Indigenous lactation professionals and advocates, to reclaim breastfeeding as food sovereignty. 2020 has been a period of collective reckoning of the structural racism inherent in all of our systems and communities. May we work together for justice and to reclaim breast and chest feeding as the norm for all. Thank you, everyone.
Thank you, Tina. I also want to just take a moment to look at the agenda for today and just kind of review that with you guys. For those of you that are wanting a little bit of a different view, sometimes it can be helpful to view the screen in, if you go up to the top and if you click on the 3 dots, there's a side-by-side function, and sometimes that's a little bit easier to view what is being presented on the screen, as well as maybe any of the potential speakers. So just a little reminder of that. So with the agenda today, we kind of have it broken into 2 sections. We will be providing a lot of different updates on some different projects or what's been going on with MBC. Then we'll take a 5-minute break. And then when we come back from that break, we will be doing a little engagement activity. And we are asking for all of you who are here today to help participate in that, as we are seeking some of your input and feedback, and we are hoping to have a really good interactive and some good conversation at the end of our time together. So now I would like to just take this opportunity to thank the 5 individuals that you see up on the screen. These individuals will be leaving the board at the end of this year after completing their terms. Des Ahrens, Marsha McCoy, Lisa Roberts, Jill Bronofsky, and Candy Wagerson. Thank you for your time and energy you have given to MBC and the lactation community. Thank you for continuing to keep MBC's best interests a priority, and thank you for your patience with me as I navigated being your chair this year. I appreciate each of you for what you've been able to bring to the board, the productive discussions, variety of perspectives, and willingness to explore new ideas. It has been my honor to work alongside each of you the past couple of years, and we will miss you. So thanks again. Next, I would like to welcome Ann Oswood, NBC board member and chair for our nominating committee, to present our incoming 2021 new board members. Let me see if she is on.
I don't see her name on the participant list yet.
Okay, she may not be on just yet. Let me see here. Well, I will just, maybe we can. Okay, yeah, she isn't on yet. I will just go ahead and introduce our new board members. So sorry about that. I think Anne did have a client leading up to this, so I was hoping that she would be able to be here in time, but unfortunately she's not. So again, Anne was our board, is a board member, but also the chair for the nominating committee. So she really kind of helped lead the efforts for our new board members. So I do want to just take this time to acknowledge the 5 individuals that are up on the screen. They will be joining the board in 2021. So we have Shoshana Kraft. She will be coming in as our new secretary. Lindsay Heidelberger will be coming in as our treasurer. Ann Dorman is an at-large director. Akmiri Sakra is another at-large director. And then we have Melissa Gutierrez-Nelson, another at-large director. So please join me in welcoming them to the board in 2021. I'm really excited to get to work with them a little bit more closely in the next year or so. I was part of the interview panel and got to learn a little bit more about each of these individuals and a lot of the skills and qualities that they have that they're able to bring to the board is something that I think is really going to really help us succeed in reaching some of our goals over the next year or two. So in addition to our new incoming board members, we will continue with some current members as well. So like I said before, I'm Katie and I am your current chair of the board, but I will be moving into the past chair role as we get into 2021. Tina Luxratz is our chair-elect and she'll be moving into the chair role come 2021. Ann Oswood, Jeannie Freeby are other 2 at-large directors that will be continuing on the board in 2021. And then also up on the screen is Linda Kopecki. She is our current interim executive director. So again, I am just really excited for our new board members and I can't wait for what 2021 will bring. But before we go any further, I think it is only right to look back at 2020. And what a year for so many reasons. I don't know if all good, all bad, but definitely what a year. I think that kind of sums it up. So on the screen, we have an overview of some of the key events that have occurred this past year that I wanted to briefly mention. But in no ways is this an inclusive list of all the hard work that NBC's leadership team and volunteers have contributed this past year. As noted in the agenda, we will be providing numerous updates on various projects in just a little bit, but I just wanted to take a little moment to just say thank you again to all of those who continue to show up during these very uncertain times, and I'm forever grateful for your continued support to NBC. So let us take a walk down memory lane. Let's go back to January 2020. And can you picture what you were doing then or thinking about? It's kind of hard to remember, really, with everything that's been going on this year. But were you starting to work through some of those lofty goals you set for the new year, or trying to figure out how to navigate Minnesota winters? Here at NBC, January brings a shift or transition in our leadership. We welcomed new board members and said goodbye to others. Another big first happened for NBC in January. Our first official employee started, Linda Kopecky. She started in the role as NBC's interim executive director. And this was a huge step for NBC, as it has been instrumental in our ability to accomplish all that we have been able to do this past year. So thank you, Linda, for courageously and confidently stepping into this role and stepping up to the challenge. The beginning of 2020 also brought an excellent opportunity for NBC to relook at our strategic plan. This refresh was the first step in outlining some specific goals or areas of focus for the next 1 to 2 years. And in February, NBC sent out its first monthly newsletter. So if you don't already receive it, it is a great way to stay informed, and it is super easy to sign up for. You just need to go to the NBC website, and on the left-hand side down towards the bottom is a place where you can get that. If you have any questions or if you need any help finding that or getting connected, let us know and we can definitely help you. As we continue to move through 2020, March came and COVID hit. So I'm not sure if anyone could have imagined at that point what the rest of the year would bring. And like many of you in your organizations, as well as your personal lives, had to shift and pivot, so did NBC. NBC started the COVID-19 task force to pull together and make available information regarding lactation and breast milk feeding during COVID. It is important that NBC provided a place for the community to get information and a dedicated team to pull that together. March also brought the start of our partnership with the Minnesota Community Health Worker Alliance, and you'll be hearing a little bit more about that later this morning. In April, NBC held another successful local coalition teleconference, but this year it was over Zoom. It was the start of the potential opportunities that were presented when having to shift to virtual platforms. And as we were coming out of spring and into early summer, and as you all may recall, the killing of George Floyd in late May and the racial injustice and unrest that followed and continues was a grim reminder of systemic racism throughout our community, state, and nation. This speaks not only to our own biases within NBC and to the lack of true representation within our leadership, but also that work needs to be done in order to dismantle white supremacy. The intersection of the pandemic and the June riots meant access to grocery stores was limited and the need for food was in high demand. And this was the start of the Food Pantry project that Kayla will be talking about again in a little bit. Another change that occurred this summer involved revamping our board recruitment process, with the goal to increase the diversity of our board, in addition to expanding the skill sets, perspectives, and backgrounds of our board members. And I would have to say, I was really excited with how this new process evolved and worked out. As you could see with our new members that were just introduced, they come from a variety of different perspectives, from work settings and skill sets, and I think they're really going to be a valuable asset to NBC as we move forward. In September, we held our fall workshop, and earlier this month, the summit, both done virtually and were a big success. Thank you so much to the planning team who has had to, again, shift and pivot in more ways than one when it came to these events. Typically, we hold the summit in the spring. So just as COVID was ramping up, that was a lot to kind of take on how do we go from having this typically in-person event in a relatively short period of time and having to adapt and change to the ever-evolving situation around us. So thank you all to our community around the state, to our planning team again for really working hard and diligently over the last several months to put us in a position that allowed us to have success, still meet the needs of those who are able to attend, and share valuable information about lactation with those around us. And that brings me to today, our virtual annual meeting. Again, another new thing for NBC. I do have to say that one of the things that I think we can take away from this year is that while there's been definitely many challenges, There's been also opportunities for us to get creative or think out of the box on how we continue to engage and work with everyone in Minnesota. We are currently assessing and communicate our communication channels through 2 different communication roundtables. And we're also planning for the winter teleconference. Another new thing that we're realizing is capable or able to happen in the world of virtual platforms. In addition, the board will start to work on our vision and goals for the next year at our board meeting in December. So that's another thing that we have looking forward to in the next couple of weeks. So I just wanted to again say thank you to everyone who's able to be here today. For those who aren't able to be here today, all of your support means a lot to us. And without all the work that you continue to do in your own communities, we just want to be able to be in the place where we are now. So with that, I'd like to start kind of moving into some of our project updates. So to get us started, I would like to welcome Barb King to provide us with our first project update of the morning related to the Seed Money Project. Barb?
Hello, thank you, Katie, and thank you for everyone to attend. It's wonderful to be here virtually from St. Paul. I'm giving a Seed Money Project update, and what's exciting is a year ago is when we announced the Seed Money Project at the annual meeting in Rochester. And with that seed money, the Board of Directors made $12,000 available, unlock that money to local coalitions to jumpstart an activity in their community with a focus on coalition strengthening and breastfeeding friendly work sites and childcare. It was really exciting to just kind of say, here's some money, have at it. We received 11 applications and we reviewed them, and the work group read all of these, and all of them had wonderful merit, all 11 applications, and so much so that we had a hard time picking and choosing which ones would get funding. So we actually went back to the Board of Directors and asked for an additional about $800 so that we could fund all 11 applications, at least partially. So a total of $12,800 of funding was given to 11 coalitions, and they were all funded anywhere from 50% of what they had asked to 100% of what they had asked. The money was awarded in early January 2020, and the coalitions got off and started working on their projects. And then, of course, as we know, and this will be an ongoing theme today, COVID hit. But what's been amazing is these 11 coalitions have taken COVID in stride. In August, we convened 2 teleconferences to bring all of the awardees together to participate, to share progress, to trade their ideas about how they were innovating, how they were pivoting, to give encouragement to each other and share ideas on how they were moving forward on their projects. It was a great time for everyone to come together and kind of get restarted again as we saw that we were really in COVID for the long haul. All coalitions are being flexible and they're adjusting their plans in light of COVID. And many of them are actually partnering with community organizations to leverage additional funds in their community. And I kind of see the seed money as a little bit of a fertilizer in the in each coalition to say, hey, we've got this money, what can you do else in our community to help us with it? So even with COVID, this photo here, the photo montage, shows some of the successes so far that have actually happened all across the state with different projects. And this is just some of them. I couldn't fit them all in one slide. In September, each coalition submitted a progress report, and we're currently offering individual Zoom calls with our individual coalitions to check in, to see what they're doing, what successes they're having, and how MBC can continue to help them thrive. We did extend the deadline for the seed money projects being finalized. It was supposed to be December of this year, and we've extended it for 6 months because of COVID. We'd like to thank the board of directors for trusting these coalitions and sparking this creativity for individual coalitions around the state. I'd also like to thank the work group that is helping with this project, and that's Megan Kirby, Stephanie Johnson, Shua Vang, Linda Kopecki, Holly Glaubitz, and myself. And next year at this time, we will be sharing a final report and sharing the individual successes of these different projects. And you'll also hear of these at the different teleconferences and meetings that we have. This is a great work group to be on. It's a wonderful, diverse work group, and I've really enjoyed getting to know the other members of it. But what is especially meaningful for me in this work group is to see all of the different projects and innovations that go on, that communities are doing to meet the needs of their unique residents. And it's been really inspirational to see, and I've had a great time getting to know a lot of people across the state, or re-meet some people that I hadn't seen for quite a while. So thanks so much for the opportunity.
Wow, thank you so much, Barb, for sharing and providing us with that update. I can't wait to hear more about these projects over the next year, and wish them all great success with it. The next update will be presented by Carol Boosman. She's our project director for the 10-Step Learning Collaborative. Carol?
Yes, I'm pleased to be here this morning. Just a little bit of a background. I sat the first time for the lactation consultant exam in 1990, and working with breastfeeding families and maternal child health has been a passion of mine for a long time, and it's exciting to work with this collaborative and influence the care for hospitals in this network. So there was a CDC grant that was written and awarded to the Department of Health and operationalized through the Minnesota Breastfeeding Coalition. We began the project in August of 2019, soliciting hospitals to meet in a quality improvement community. So it's from 4 different hospitals. We've met, looked at what are the 10 steps, which are the World Health Organization's 10 steps to successful breastfeeding. And step 4 begins in the hospital through going home. Step 1 is just your policy related to it. Step 2 is education and skill sets for staff that work with breastfeeding families. Step 3 relates to how you prepare mothers and families ahead of time. So these organizations we've met, we've looked at the steps, and then they determined what steps they wanted to work on. The Minnesota Department of Health has a breastfeeding friendly recognition program, and the grant goal was to complete at least 2 steps, which equals 1 star for the Department of Health's program. And like I said, we began meeting late November. We met via Zoom before Zoom took such a prominent role in our lives. And then, like Katie said, the pandemic came. And for hospitals to flex and meet the resources for what the pandemic brought to their patients, their communities, it has definitely eclipsed some of the work that we've done. But what is interesting interesting is the passion that these organizations have continued, and they continue to work on these steps, albeit not quite at the pace that they had planned, but they still are moving forward, which is exciting. So I'd like to acknowledge their work. The next slide is a little bit, it's a little more complex slide, but what is here is a map from the state of Minnesota. And you can see the exclusive breastfeeding rate goes from deep purple up in northeast Minnesota and to lighter shades in different places. The little circles are hospitals that were birthing hospitals in 2012 but are no longer birthing hospitals. The purple H's are hospitals that birth, and I know at least one that has become a circle now, but the gold H's are hospitals that have achieved the baby-friendly status as by Baby Friendly USA. There's 14 hospitals. This is a rigorous evaluation and work that they've done, and they've done an excellent job. Then there are also, and I think if you click, it might show up on the slide next. Let's see. Yeah. These are hospitals that have been historically baby friendly. They were certified and have done a lot of work. Austin, Minnesota, Mayo Clinic Health Service was the first, and then there are others. And then you can click again, the Minnesota Department of Health, their program for the 5-star rating. Cloquet Hospital completed that, which is great work. And then you can click through and it shows the hospitals that are on our current 10-step collaborative, and that's St. Cloud, Centricare in St. Cloud, CHI St. Joseph's in Park Rapids, Lake Region Healthcare in Fergus Falls, and Northfield Hospital and Clinics in Northfield, Minnesota. So what's nice to see is these are spread throughout the state, and as I said, their passion is continuing, and they're working on some of the 10 steps, 2 to 3 of them. Some of them have started data collection, some not. There were small grants available if they requested for some of their work, and a couple of the hospitals have done that. And then lastly, the CDC grant was extended, and so there's an open invitation for hospitals to join the 10-step collaborative. Tomorrow at noon, and then on December 9th at noon, there'll be informational calls. There'll be the same call, and I invite inquiry by hospitals. There's no commitment by just listening into the call, but what could be done to help your organization move and get these best practices solidified. You know, we all think we're doing well, but when you start to measure it, it's like, oh, I guess there is room for improvement. So if you know of any hospitals that are interested, send the email to the Minnesota Breastfeeding Director, and I can put that in the chat when we're done. Linda Kopecky will work together, and we'll send out a Zoom link for these phone calls. It's been wonderful to see the work done by these organizations, and I'm honored and privileged to help them look at that. So thank you very much.
Thank you so much, Carol, for sharing. And it's great to see that work is still able to be done, especially with everything that's going on. So next, we were going to have Kayla talk a little bit about the food pantry project. Unfortunately, she isn't able to join us at this time, so I'm going to pass it over to Linda Kopecky, and she will be sharing about this with you guys.
Thanks, everybody. To Kayla Lightfield, I just want to mention, Kayla Lightfield is she has a few roles that are related to the Minnesota Breastfeeding Coalition. She's one of the co-chairs of the Indigenous Breastfeeding Coalition. Kayla is from South Dakota. She is Lakota, and she is one of the amazing co-chairs of the coalition, but also facilitates the ongoing virtual support group with Shoshana Kraft and a few others for Indigenous families. But also she's a Master's in Public Health student at the School of Public Health, and so she's an intern with the Minnesota Breastfeeding Coalition too. We have 2 interns this year, and Kayla is one of them. We connected her with the food pantry work because she's quite interested in particularly the way formula gets from the big formula companies out to communities through some of the aggressive marketing and some of the roundabout tactics of the formula companies. And food pantries are a part of that. So you can go to the next slide. So it's 3 tasks for her internship project. The first one is helping with communications roundtable. We've had the part 1 and we'll have part 2 tomorrow. There's still an opportunity to join the communications roundtable. If you're interested, please mention so in the chat and we can send you the link. Communications roundtable is tomorrow from 9:30 to 11:30. And the reason that we're working with Kayla on the food pantry project, and then you'll hear from Anu Ayeni next with the community health worker project we're having them work on the communications roundtable, is that their projects are affected by communication. We're food pantries, we're asking, like, how does Minnesota Breastfeeding Coalition communicate with partners like food pantries, with statewide partners like food insecurity organizations? How do we communicate with them? How can we be the resource? How can Minnesota Breastfeeding Coalition be that subject matter expert, but be in true, authentic partnership with them? And that relates back to how we communicate out and how we communicate with each other. The second part is, this is an infographic. This is one side of an infographic that was created in response to working with the food pantries. And this began in the summer, started with the riots when immediate food deserts popped up in Minneapolis and in St. Paul. And it was actually spurred by communication with Kimberly Stills-Allers, who's a national expert in communication and framing around lactation, particularly for BIPOC communities. So we created this, a larger group, including NBC, but also other partners, created an infographic and that can be used by food pantries to put into food boxes or food bags. So any client who has an infant who needs infant feeding suggestions, support, guidance, resources can use this. The other side covers mixed feeding, so breastfeeding and using formula, and then also safe formula preparation. I want to say that this also was a big inspiration for having this one-pager was some work by Anna Brauch, who created a one-page document for working with food pantries when she did some of that on her own and through her work this summer, and many other partners contributed. But I want to give special recognition to how she paved the way. So we're working on pricing it. How much would it cost to print all of these infographics? Do we have money in the MBC? How do we get it out to food pantries? So the third part of that work is Kayla having listening sessions and communication with different food shelves. And we've already started that. And it's just having a conversation, learning how different food pantries, food shelves, food insecurity organizations operate, learning from them, learning how they support families with infants and their feeding needs, and then identifying how NBC can be a resource to them.
Thanks, Linda. So next, I would like to welcome and introduce our other MPH intern. Linda mentioned her briefly, again from the University of Minnesota, Anu Ayeni, and she will be sharing about the Community Health Worker Project. Anu?
Hi everyone. My name is Anu, and I am currently completing my master's in epidemiology at the Minnesota Department of Health School of Public Health. I'm at the University of Minnesota um, School of Public Health, and by reason of an internship I completed over the spring and the fall, I was able to work on the community health worker facing project, which was um, primarily aimed at training community health workers as infant feeding advisors. Um, the overarching goal for me was to kind of develop and build communication skills and communication in the um, professional sense. So, like being able to um, communicate in the simplest forms to a variety, like to a wide range of audiences. Of course, the focus was community health workers and allied professionals, but like everybody that would have reason to work in the breastfeeding space. We um, developed content, which I kind of like led. We developed content for continuing education webinars for community health workers, and this was a 3-part webinar series where we invited experts and subject and experts and like senior colleagues within the industry to talk about for the first webinar just like breastfeeding basics and share tools and resources for community health workers. And we did the first part on the 13th of July. We had as chief facilitators Ann Oswood and Fua Kang. We also followed this webinar up with the second part, which covered the world of breastfeeding. Sashana Craft also helped facilitate that session. It took place on the 3rd of August. And then we followed this by the third part of the webinar series facilitated by LaSharon McDonald, Ann Oswood, and Shandy Mangara. And we covered breastfeeding and returning to work and school. And this took place on the 31st of August. Okay, I'm sorry. And this took place on the 31st of August. Does this sound better? I hope this sounds better. I hope I sound better.
Sounds great.
Okay.
That sounds great, Anu. Thank you.
Yeah. Okay. And all the recordings are up on the NBC events YouTube page. And I actually checked the YouTube page last night before just to make sure that I had the accurate information about like just how I felt like the reach for the webinars were. And altogether, all 3 webinars had under, I think, 45 YouTube views. And this kind of drives me to the next point, which was the communications roundtable that we had to kind of seek to maximize all our communication platforms. So starting from the website to the social media platforms, and just to make sure that we are reaching all of our audiences with our resources and things that we have on there. And I think that there's only we can like make resources available. We can like be like that one-stop shop for community health workers and people who work in breastfeeding. But if nobody is seeing like all the resources that we have, it might as well be, all of it would be for nothing. So I think this kind of helps me kind of explain why we need to maximize our communication platforms. From the first communication roundtable that we had on the 28th of October, we were able to realize through discussion from all the people who were present that the websites had the most potential for just reaching our communities. And just like we think of the websites as the hub where you're able to kind of link every other communication outlet, so like the YouTube pages, the social media, Facebook, Instagram, the newsletters, and even the internal websites. We are coming together tomorrow for the second part of the communications roundtable to kind of continue the conversation to see how we can move forward with respect to kind of like making this resource making it what we expect it to be, as in with respect to like just being like just being able to reach the people that or our audiences, like the people that we actually intend for our resources to reach. Yeah, and I think that kind of wraps up everything that I wanted to say.
All right. Well, thank you so much, Anu. You know, it's definitely a good reminder for us to know that these resources are out there. Thank you so much for Carrie for putting the link. If anybody's interested to these, the YouTube videos, the webinars for the community health workers that were done, the link is in the chat box. If anybody's interested in going to view that, share it with others in your organization or with those that you know, especially if you are around others who are community health workers or kind of that are in those types of roles. So thank you so much again, Anu, for sharing this information with us. And I definitely agree. I think it's opportunities like this where it's great to take advantage of taking a step back and really diving deeper into our communication. So next, now that you've heard a little bit about some of the projects that have been going on this year, we're going to shift focus a little bit and talk and provide a financial update. So I'd like to welcome Marcia McCoy, NBC's treasurer, to provide that financial update for everyone.
Oh, good morning, everybody. I thought it would just be sort of nice to take a little bit of a overview, and I'm not going to go through all of these in detail, but they are in the slides if anybody's interested in really looking more at the detail. So just a general overview. This is 2020 year to date, and what you can see is on the left is the total cash that we've dispersed during the year, which is $98,000. And then the amount of money that we've received, which is $116,000. So for the year to date, we are a little bit ahead on income over expenses. And you can see that most of the money that we get is grants. And then we get a smaller chunk from, there's $12,000 that came out of our reserve. That's the light green for the mini grants. And then we get a little income from registrations and donations. And then for most of what we're paying out is money to pay subcontractors such as Carol, who's running the 10-step learning collaborative. And for our one staff person, we have payroll expenses. And then we also disperse grants. So next page. And then I did some overviews of some of the major projects we're working on, because it's just helpful to remember what we're doing. And these are not exactly to scale, but I made them different sizes to kind of indicate the relative amount of money we're talking about. So for example, the Perinatal Hospital Leadership Summit had a way smaller budget than a typical year, less income and less expenses because we were not paying for food or facilities or any of that kind of stuff. So you can see that we made income on the Leadership Summit. And then the Bigelow Grant was a grant that was, you can see it was received, a $25,000 grant, and it's all been spent. Linda, did you have anything to say about the Bigelow Grant at all?
So this is Bigelow Grant is one that's managed by the St. Paul Foundation. which is, I have to say, this is a feather in our cap to receive a grant from the St. Paul Foundation. And it's not, because normally we've been receiving grants from hospitals or insurance companies or health-related organizations. So just a community foundation is funding something towards breastfeeding is really exciting. And this was the partnership with the Minnesota Community Health Worker Alliance. So everything that Anu was commenting on about community health workers, that was funded under the Bigelow Grant.
So this is where the training workshops came from. Yeah, and then the fall workshop, you'll see, again, the fall workshop is a tiny piece of our budget, but we did make some income on it. And we have very few expenses. A lot of volunteer effort goes into those workshops and summits. Next slide. And then the 10-step collaborative, this is the project that Carol was discussing. And most of the money from that goes to the project coordinator, that's Carol, for her time. But we also bill some of the MBC staff time, so that's Linda Kopecki's time. And so the 10-step collaborative partially funded the summit because the summit is a piece of that promotion of the 10 steps for hospitals. And we also took an indirect fee for SPAN. So you see that little purple box is just overhead fees. And these little pieces of income that you see are related to sort of how we're funding having a part-time staff person. A little bit of money from here, a little bit of money from there, and it kind of adds up. Then the Minneapolis Foundation, this was Linda, do you have something you want to say about this one? Maybe I'll leave it to you.
So this is another grant that is, again, a community foundation, which is exciting. And this is a particular grant that cannot go to staff people, cannot go to ongoing projects, really has to go to capacity building. So website, learning how to be a nonprofit, some subcontractors, some equipment, that's what it can go to. And they extended this for 3 months. So December 31st would have been the deadline for finishing this grant, but due to COVID, they extended it to June 30th.
So, and this is really nice funding to have because a lot of funding is tied to specific projects, and this is funding that actually is helping us to strengthen our organization moving forward. So, for example, we now have an MBC laptop. So we own a piece of equipment. And we've had several trainings that people have attended. Next slide. And then when we look at general operations, this one doesn't look as great starting out because we have more expenses than income. But I would just point out that the seed money grants, this was money that was in reserve from profits from events and things from prior years. So we made this commitment to spend this $12,000. And so in that way, our expenses have exceeded our income. And this is just an overall picture of what we're paying out and then the income that we're getting. So this does not include the small amounts of profit from the different projects. And so when you add that up, that's where we kind of come out where we are balancing for the year, is that we did get a PPP loan, which was to replace the lost income from not being able to do the summit in the spring, and that was $11,800. And right now we have an application in to convert that loan to a grant so that we don't have to repay it. And then we have some income from, like I was saying, billable wages, and that's for Linda's time working on projects that go under grants. And if you can see, the green one on the right is just straight up donations. And that's not a very big piece of our income right now. Our income is mostly from support from grants and from Minnesota WIC, and then profits that we make from putting on events. Next slide. There are also a few other projects that I didn't do income expenses for that we are running, and MBC acts as sort of a clearinghouse for some of these projects. So for example, Ramsey County did a project for breastfeeding friendly public spaces, and that just finished because the end of Ramsey's fiscal year is October 31st. And basically we disperse the money for them and then they pay us back. So it's mostly pass-through money. And then the Hmong breastfeeding project, they had they had a contract that they are using us as fiscal agent for, basically. And then we have some funding for from WIC that they have been giving every year to help support equity in breastfeeding. So that's pretty much an overview of what's happening. You can kind of see what we're doing by looking at the money. That's one way to kind of judge what's going on with the MBC.
Thank you so much, Marcia. I think that definitely is helpful, especially after hearing about these projects and how that kind of plays into the bigger picture. Now I would like to welcome Carrie Clune. She's MBC's Governance Subcommittee Chair and the Peer Breastfeeding Coordinator for the State WIC program to provide an update regarding Coeffective. Carrie?
Good morning. So if you were at the annual meeting last year, you would have seen Mary Johnson provide a little bit of preliminary results from a survey that was sent out to all of the local and cultural coalitions across the state of Minnesota. So she shared just kind of a little snapshot of the survey that wasn't yet complete. So I'm here to kind of follow up with that and provide that more complete survey. And then just for a little bit of kind of Coeffective 101, when I joined the state Minnesota program a year ago, it took me probably 6 months to figure out what Coeffective means. And I kept asking, what's the elevator speech for Coeffective? Because, you know, I think it's a really cool organization that we're able to have a partnership with since 2018, but it's a little bit confusing because you might know them from the app. They have a free app that you know, families can use who are pregnant or human milk feeding. And then they also have some projects that they do to help bring people together. So Coeffective really is about bringing all of the partners across sectors who work in maternal child health to work together. So kind of the idea that when we work together as a team, we get more accomplished. So that's why sometimes it's confusing because you're like, are they an app? Are they a website? Are they, you know, what do they do? But really it's because it's all of those things. So yeah, if you want to move to the next slide. So 176 coalition members from 20 different local and cultural coalitions participated in the survey that was sent out last year. So you can see an example of all of the wonderful, you know, breastfeeding advocates that we have across the state of Minnesota. How exciting to have 176 people who, you know, shared their voice from all of these surveys from across the state. And so we will provide just an overview of that collective survey for all of them combined. And then if you're one of the 20 local cultural coalitions, you also will receive a report specific for your coalition. So we'll be sending those by email this week. If you want to go to the next slide. And across all of our coalitions, the strengths were really the knowledge for lactation support, enthusiasm, passion, and commitment of their members. So we can see that by how many people we have attending this, you know, meeting today, and then by all of the great work, you know, that Barb shared in those seed money projects and just all of the enthusiasm that's happening here. Areas for improvement really would be funding. So we have a lot of people who are excited to do the work, but needing more resources to accomplish that work. And we want to make sure that we are representative of the community that we serve. So looking for more diversity in our members. So the, you know, main areas that people really wanted to focus on by participating in coalitions were establishing consistent breastfeeding messaging within their community to make sure that when someone is pregnant and they're in the clinic and in WIC, that they're going to get that same information at the hospital, that same information from family home visiting when they go home, the same information from their clinic when they receive, you know, pediatric and family care. So we want to make sure that we're helping to be that bridge to provide that consistent messaging, and then also improving connections. So we want to make sure that to have that consistent messaging, we need to know who our partners are and be collaborating with them to share that information. If you want to move to the next slide. So how can MBC support our local and cultural coalitions? Things that people shared that were helpful were events like today. the annual conference, workshops, teleconferences, annual meeting, and on also the NBC toolkits. And then really looking for increasing that diversity, as we mentioned, opportunities to share as a coalition. So looking for more opportunities to come together and share what's going on in your community, spark ideas from what other people have done, and share the great work that you're doing. And once again, that funding piece comes in. We need to be able to fund this good work. So we will be doing a little bit more the engagement activity to really get at what does the Minnesota Breastfeeding Coalition mean to you? What can we do to help make sure that your work is meaningful, and what resources and tools do you need? So this is just kind of a good snapshot of what people have provided, and then we want to dig in a little bit deeper later in our meeting to really get at, to flesh out what that means, and to make sure that we have that, all of the tools functioning. All right, next slide. So another piece of the Coeffective project is a community match. And so if you are a WIC agency or a hospital, you might be familiar with the community match term, because there were match reports that were on paper that helped make sure that hospitals and the WIC agencies that serve the same participants were connected, and providing some tools to really bring those groups together. They moved this onto an online platform and then added in more sectors. So we want to make sure that we are inviting partners from all of the maternal child health players into this resource. And I kind of see it as just an online directory, so that we know who am I looking for, who are the contacts in my area that are doing this work. But then also it has tools built in to help say, okay, these are the people that I want to work with, and they're also interested in working with me, and here are some tools to help us get connected. So that's kind of what Community Match has been, and you might have heard about it when it was rolled out last spring, and it was really an internal, just for those partners to look and connect with each other. And now in September, they just added an external facing component where participants, families who are looking for lactation support can get connected, so that this is a great way for you to advertise the services that you have. And it's also something that we've been looking at in WIC, and also with the Breastfeeding Coalition. How can we keep people up to date with COVID and all of the resources changing? How do we know who has outpatient lactation services, who has support groups online, who has those services in this ever-changing COVID response? So now there is a feature that participants can search for those services. So we invite everybody, if they don't already have a platform, to join. But if you do already have a platform, all you have to do is open up your dashboard, which is just kind of the main thing you'll see when you log in, and you'll click a little button that says display my organization's profile to the public. So that's the only step you need to do to make sure that you can be seen by families. If you want to click to the next slide. But you can also, kind of beef up your profile by adding, your social media information. You can upload brochures for your organization. You can put as many contacts as you want, your hours of service, and then at the bottom picture there, you can add, do you have group classes or home visits, individual inpatient or outpatient services. So you can really customize that information that you're sharing with the general public. We will be having some webinars that are scheduled for currently the WIC partners, and we're going to shortly be scheduling one for non-WIC partners to give you a little bit of more information and kind of walk you through this, because it can be a little bit daunting when you first open it up to figure it out. But always feel free to reach out to me. I'm happy to answer any questions. And it is a work in progress. They did just add this feature, external facing. So if you see something and you think, this is a bug, this isn't really working well, or this would make it a lot better if it functioned this way, I'd love to get that feedback from you to share with them, because I'm sending them emails each week with things that I would like to see it improved upon. So I'd love any feedback as well. That's it. Oh, never mind. One more thing. If you are looking for partners and you say, oh, okay, these are the people in my community that I'm working with, but you don't see them yet on there, you can click the add or invite a community partner, and that will send an email inviting them to join the platform. And then if you currently aren't a member if you don't have a profile on the Community Match platform, you can follow this URL, and I'll put it in the chat to get started on setting up your own profile. The only caveat we have on that is we want to make sure that all of the members of this platform are WHO code compliant. So we don't want any artificial baby milk organizations to be invited. They do, once you fill out the information, it does go to Coeffective and they review it before it goes online. So hoping to catch people like that, but those are kind of the main guidelines for who to invite. Thanks.
All right, thank you so much, Carrie, for that update. I know I work for WIC at a local agency, so I know that that is something that we are looking forward to learning a little bit more about and how that could be effective within our community. So hopefully everybody else is feeling the same. So now that you've heard a little bit about what we've been up to this last year, I'm honored to introduce Linda Kopecky again, our Interim Executive Director, to talk a little bit about what's next for MBC.
Thanks, Katie. You can go to the next slide. I'm going to make this quick because I'm the last bit of the business section of this meeting when it's really talking heads talking at you. And after the quick break, we're going to come back and we'll be talking with each other. It'll be much more engaging, fun. Not that this hasn't been fun, but it'll be more fun. So just want to tell you what we're looking forward to in 2021. The board does have a board meeting coming up in December where we're going to be setting some goals and looking forward to 2021. So I don't want to get ahead of that. But there are two major commitments that I have made to the organization, and they're just here. The first one is we're going to diversify our revenue. You saw that our income is primarily grants right now. And if you had looked at that a few years ago, it would have been primarily income from events. So trying to diversify our revenue, this is very typical of a fairly young nonprofit organization. The need to, relying on a certain type of income, what we do well, how we first start bringing in money, but then it is very typical to need to take a step back and to diversify and try different ways to bring revenue in, just to have a stable financial foundation. And the second piece is representing our larger community. And that's representative leadership, representing our larger community in Minnesota through our teams and subcommittees. Many of you, I've actually talked to you and invited you to leadership, or I've invited you to a committee. And it's because I'm seeking your perspective and seeking your voice. We are seeking your perspective and your voice. And there are other ways to represent our larger community through strategic partnerships with organizations that whose leadership looks very different from ours. Okay, next. We're in an interim period, and I've repeated this at every steering committee and every board meeting. So you've heard this before, but I'm going to go over it again. There are 5 basic tasks in an interim period, and that's a period of transition. We're transitioning from all volunteer to one with an executive director. I'm the interim executive director. So the first one is coming to terms with history. You saw that timeline for the past year. That timeline can go all the way back to the beginning. And it's looking at why we've done things, why we've made certain decisions, where we've made some missteps, acknowledging some decisions that may not have been the best, but also acknowledging amazing decisions and amazing contributions and amazing leadership. The second piece is exploring identity and direction. Who are we? What's our niche? Where are we the subject matter expert? Identifying our place within those strategic partnerships. Number 3, making leadership and operational changes. We'll be exploring, this is the foundation of what we're going to be exploring in the engagement activity. Looking at how we do things. Are we we're not the same organization that we were 10 years ago. And we're moving towards a new iteration of ourselves. So is our leadership congruent with who we want to be? Are the way we operate, are those activities the way we should be operating? Renewing linkages, that's strategic partnerships, partnering with our local, cultural, and regional coalitions. And then when all of those are in place, we will commit to new leadership and new direction. And then Katie, you can click. And I just want to put a little bee in your bonnet that we have a couple activities coming up really soon. On December 10th, there's going to be a all coalition teleconference. And I'll be sending out information about that. That's a follow-up to the Perinatal Hospital Leadership Summit. And it's for coalitions to explore ways to better support their local maternity centers. And in January, we're having a winter workshop. It's virtual, of course. It's about policy, law, and ethics around breastfeeding-friendly environments. So work sites, schools, and childcare. And we're aiming for e-CERPs. I know those are hard to get, so we're aiming to get quite a few e-CERPs for this. And that's it for me. I think we're going to go into our break now for just a few minutes. So don't go away. When we come back, we'll be talking to each other, and it'll be really fun.
All right, thanks, Linda. Yes, we will be taking a 5-minute break, so you can, if you're